Dear colleagues, in this session of the atom, I will introduce to you the technique of doing medial pie crusting to improve visualization for the medial gutter of the knee. Today's patient is a 50-year-old lady. She has a medial meniscus root repair and has got restored joint space as is seen on the x-rays. The MRI scan demonstrates the presence of a root tear of the posterior horn of the medial meniscus, and our endeavor today would be to go ahead and repair this root tear, which is very well visualized on the axial sections as is demonstrated in the MRI scan now. Such patients are usually a challenge because they're usually females in about the age group of 40 to 50, and they usually have a slightly heavier build, which makes the accessibility of the medial joint space a problem. The portals that we would use would be the standard portals, and through the standard portals we can now see that the medial meniscus is visualized. We can see that there are a few chondromalacic changes on the tibia as well as the femur, and the presence of a root tear is seen, can be demonstrated, but we know very well that this space is too less for our instruments to go through, and this may cause iatrogenic scuffing of the joint cartilage, which may then lead to more problems. The technique that I will show is pie crusting of the MCL. So we take an 18 number spinal needle and feel for the posteromedial corner of the tibia and make a series of small jabs on this superficial MCL, and at the same time apply valgus pressure to the knee joint. At one instance, you will see that the medial joint space opens up, and now you have enough access to the medial gutter and the posteromedial aspect of the knee joint to allow instruments to pass through with great ease. As we can see here, we are inserting the needle and we are making a series of sharp jabs on the superficial MCL, and now suddenly the joint space opens up, and this opening of the joint space is now enough and is useful to allow all our instruments to pass through easily without causing iatrogenic damage. One can see now that the root of the meniscus is much better visualized. Our instruments can pass through with great ease, and this very helpful tip that we should all use and go ahead. This root repair was repaired as per the standard techniques, in which a transtibial tunnel was then drilled, and this was used for sutures to pass from the meniscus through the transtibial tunnel, and then the root was repaired down to the anterior medial aspect of the tibia. There is no risk of causing iatrogenic damage or an iatrogenic rupture of the MCL, and I urge all our members to use this trick when we find that the accessibility to the medial joint space is a lot compromised and we are dealing with a very tight medial joint. Thank you.